During the countdown, I'd like to hand out a bit of a cinder block and ask everybody just to pass it along, hold it for about 5 seconds, feel the weight, feel the texture, and then just pass it along. I'm Kevin Renner, and I actually have kind of a strange career. I work with healthcare companies, usually about 3 at a time, to help them go to market. And I'll be talking about one of those companies tonight. It's called Mindful. So my opening question is, what do these parties have in mind on this slide? These are who we blame for healthcare costs, right? The docs, Obamacare, the hospitals, the insurance companies, and so forth. But if you look carefully at health economics, hospitals comprise about 31% of the $2.7 trillion spent on healthcare in the US. There's obviously inefficiency in hospital organizations and health plans, but if you look at that $831 billion spent on hospitals and 10% of it was inefficient, you would reduce total healthcare spend by 3%. That's next year's health inflation. 50 countries have longer life expectancy at birth than the United States. So our issue is not, it's not poor medical technology, there's something else going on. And I'm shining a different lens with this company on where's the fat in the US healthcare system. A couple of things to think about are that 75%, approximately 3/4 of all healthcare spending, is driven by chronic conditions. About 25% of the employer healthcare spend in the United States is driven by modifiable health risk factors. This is really obviously significant. So Mindful has a solution that goes back to the beginning of that chain. What we look at is tackling the maladaptive behaviors that are responses to stress and working on those because it's maladaptive behaviors that are driving so much chronic disease. So at a glance, we've developed programs with Duke and a number of leading institutions, and you can see who our early customers are. We just had an RFP today from a company with 255,000 employees who asked if we would be interested in submitting a proposal to them. I haven't talked about what mindfulness is, but some of you may know it. It's just the mental practice of pulling yourself back into the moment. I equate it to a rowing machine in the gym. 1,000 times a day, you're rowing yourself back from the future or ruminating about the past into the present moment. And the model that we have as a company is that we're really, again, looking to address stress and then how it drives maladaptive behavior and how those behaviors drive chronic disease, which drives healthcare costs. This is no longer alternative and complementary medicine. This is very mainstream. Okay, it's practiced now. There are mindfulness centers in over 200 medical centers in the US. The graph to the left here shows how many academic and scientific papers have been written on mindfulness over the last 20 years. You can see it's just exploding. And perhaps the ultimate test is how many apps are there? Almost 3 dozen now. This is just a slide that shows what our classroom looks like. So we offer these classes in what we call a virtual classroom. It's online, you don't have to drive anywhere, you click on a link and you're in. The instructor teaches live, you can chat with the other students, you can visualize the instructor and each other through webcams. It's a virtual classroom experience. And so the 7 core programs that we have so far are these to address the principal causes, the real heavy hitters in chronic conditions. So again, there's stress that drives metabolic syndrome and a whole bunch of other conditions. This is just a few testimonial comments from a number of the people who've taken our courses, so I don't need to read those. You can just take a look. But I've actually taken 2 of the classes myself, and people utterly, absolutely love them. We do a lot of data gathering. This is from an article in the Journal of Occupational Health Psychology, March of 2012, where it showed in a large sample of nearly 500 Aetna employees that the most highly stressed quintile had medical claims experience that was $2,000 a year higher than the lowest stress quintile. This is a before and after in one of our classes on the perceived stress scale. 314 people dropped their stress by 37%. This is one of the indicators within that perceived stress scale, but just to look at it simply, if you look at what happened during and after the class, just look at this bar. 8 of them said they were never overstressed. 33 by the end of the class said they were never overwhelmed. That's the trend in every time we do this measurement in the classes. So we're in a really good spot as a company We occupy this place where we're very scalable and global, but we also have a real wide breadth of programs. When I took classes, there were people there from Afghanistan, Russia, and India. So in closing, we're addressing a really big problem. We've got something that's very measurable and that we bring into the market in a really exclusive way. And I never thought I would see the day when capitalist self-interest would drive mindfulness into the culture. Thank you.